Hello everyone and welcome back to another anatomy video where we are going to start talking about the skeleton of the hind limb. In this video we will talk about the anatomy of the pelvis of the horse, and after that we are going to compare that one of the horse with other animal species. Okay, and here we have equine pelvis. So the pelvis consists of two hip bones which meet ventrally at the pelvic symphysis. In young animals, of course, the two hip bones articulate to each other, so that means inside the pelvis symphysis here we can see in young animals like cartilage, to allow growth of the pelvis. In adult animals, of course, the two hip bones are completely fused with each other. Each hip bone is composed of three parts with separate ossification centers. Here we're talking about three bones are there to form the hip bone: the ilium, this one here, the pubis, and ischium. The pubis and the ischium of each hip unite ventrally here in this area to form the pelvic symphysis. So that means the pelvic symphysis has two parts. The cranial part here is the pubic part, and the caudal part here is the ischial part. And now let's move to the lateral view here, where we can see these two bones in the lateral view. And let's start talking about the ilium. The ilium forms the dorsocranial part of the hip bone and extends, as you can see here, from the acetabulum to the sacrum, which normally articulates with the wing of the ilium in this area here. The ilium can be divided into a cranial expanded wing here. As you can see, it's very flat and big, and a little bit here we have the columnar body. Here we have to mention that the three bones, ilium, ischium, and pubis, they meet together here in the middle to form the acetabulum. That means the body of the ilium contributes to the formation of the acetabulum. The orientation of the ilial wings is species specific. So here in the horse, the wings are oriented like vertically. And very important landmark, actually in all domestic animals, not only in the horse, the coxal tuberosity. Here we have the coxal tuberosity. Up there we have the sacral tuberosity. The border between the sacral tuberosity and the coxal tuberosity called the iliac crest. And so the iliac crest extends between the coxal tuberosity and sacral tuberosity here. The wing of the ilium has two surfaces, the lateral surface, and there we have the medial surface. The lateral surface has another name called the gluteal surface, just because this is the area of origin of the gluteal muscles, and that's why on this surface we can see this very developed gluteal line. If we look at the medial surface of the wing of the ilium here, we can see like a rough surface called the auricular surface. This surface is there for the articulation with the wings of the sacrum. So here the dorsomedial border of the iliac wing is deeply concave to form the greater sciatic notch. This is actually the area where the sciatic nerve moves over the greater sciatic notch. Here we can mention also that the ventral border of the body of the ilium is marked by what's called the arcuate line. Okay, and now before we move to the next bone, we have to mention that the coxal tuberosity or tuber coxa is very important here. Could be seen or palpate in carnivores from outside. It's also very clear, and we can see it on live animals in horse and cow, for example. And it forms actually the origin of the internal oblique abdominal muscle. So now let's move and look at the pubis. The pubis is L-shaped. So here we have the body of the pubis, and so it has like a body and two branches. The body is here, and here we have the acetabular branch and the symphysial branch of the pubis. So here it's also very clear that the pubis contributes to the formation of this very big foramen, the biggest foramen in the body, actually, called the obturator foramen. Good. So the cranial edge of the pubis, called the pecten of pubis, or the pecten ossus pubis, and it forms here in this area the iliopubic eminence. Here, in the case of the horse, the ventral surface of the iliopubic eminence is crossed by the pubic groove. There is a groove here, leads to the acetabulum. Here, this groove is very important, because it forms the place for the accessory ligament of the head of the femur bone, which is present in the horse. Okay, now let's move and talk about the ischium. The ischium in general can be divided into the body. Here is the body, and we have also the caudal plate of the ischium and the medial branch there. The medial branch contributes also to the formation of the obturator foramen, as you can see here. Here we can see that the body of the ischium continuous with the body of the ilium to form finally here this projection called the sciatic spine. Behind the spine here caudally we have the lesser sciatic notch, as we said before. In front of the spine here, this concave border of the body of the ilium forms the greater sciatic notch. Here it's very important to mention this very big and developed projection from the ischium called the Sacral Tuberosity. If you look exactly the caudal borders of the ischium here, left and right, they meet together to form what's called the ischial arch. So now let's just put the pelvis in a dorsal view, as you can see here, and go through the structures. Perhaps we forgot to mention something. So cranially here we have the wings of the ilium with two very big tubercles, or projections, called this one here is the Ischial Tuberosity, as we said before, origin of the internal oblique abdominal muscle. Here toward the sacrum we have the Sacral Tuberosity. On the lateral surface of the wing of the ilium, or we name this surface as gluteal surface, we have the gluteal line, very clear, left and right here. So there's just one line here in the horse, while we are going to see three lines in carnivores. For example, if we move here, we have the body of the ilium, which contributes, as we said, for the formation of the acetabulum. Here in the middle here we have the sciatic spine. In front of it we have the greater sciatic notch. The lesser sciatic notch is here. In this view we can see also the pubis, which forms also the foramen, this big foramen, the obturator foramen. In the middle, between the right hip bone and the left hip bone, we have the symphysis pelvis. Here caudally of the ischium we have the Ischial tuberosity or tuber sciaticum, left and right. They are extremely important as the origin for the long muscles of the thigh, for example. Here both of them, they form what's called the ischial sciatic arch. If we move to the ventral view of the pelvis, again the medial surface of the ilium, or of the wing of the ilium, has what's called here the auricular cervus for the articulation with the wings of the sacrum. Here, so we forgot to mention these two tubercles. This is the tubercles for the insertion of the lesser psoas muscles, and next to it here we can see these two rough cervices. These are the area for the insertion of the straight muscle of the thigh or the rectus femoris. These two areas here we have here between the body of the ilium and the pubis, we have the iliopubic eminence. The iliopubic eminence here, this area called the pecten ossis pubis, or the pecten of pubis. If we move to this surface, we can see again the symphysis pelvis, which we say it has two parts, the pubic part and the ischial part. Here we have the two very big foramina, or the obturator foramina. Obturator foramen is not so empty, is also is actually closed with a soft tissue and muscles. So from outside here you will find like the external obturator muscle. From inside we have the internal obturator muscles. So they close them the foramen completely. Through the foramen actually we can also find three structures moving through it. They have the same name: the obturator nerve, the obturator artery, and the obturator vein. Good, and let's go directly and talk about the acetabulum. The acetabulum is formed, as we said before, by the three bones, by the ilium, by the ischium, and by the pubis. Here, if you look exactly at the acetabulum, it has a very smooth surface, is for the articulation with the head of the femur bone. This surface called the fascias lunata, or the lunate surface. Lunate surface. There in the middle here we have rough surface with some foramens here. This is the acetabular fossa. The acetabular fossa is rough because it's the origin of or is for ligament attachment, and here from this fossa we have the ligament of the head of the femur bone, or called the ligamentum capitis ossis femoris, which moves from this fossa to the fovea capitis of the head of the femur bone. Here we can see how the fascias lunata is not completely closed. There's an opening here, is the acetabular notch. This opening is supported, of course, with the transverse acetabular ligament to protect the femur head ventrally. Here, as we said before, in the horse, in addition to the ligamentum capitis ossis femoris, we have another ligament called the accessory ligament of the femur head, moves in this direction here. And now let's move and talk more about the comparative anatomy by looking at the pelvis of some other animals. Here we have the pelvis of the ox. So before we talk about the differences between the ox and other animals, so let's go quickly through the different structures of the pelvis. As you can see here, in the same way, the pelvis has two hip bones. Each hip bone is formed by three bones: the ilium, the pubis, and the ischium. The ilium, like other animals, has very big flat wing. This is the wing of the ilium, and here is the body of the ilium. Here, so while we are describing these structures, we will talk about some differences. Like, for example, here the gluteal line is more prominent and more clear comparing to other animals. So they're very thick and projected from the wing. This is the gluteal line. We say that the wing has two surfaces. This is the gluteal surface or the lateral surface, while here is the medial surface, where we have, if you remember, we said let's go to that surface here. So we have these two articular surfaces with the wing of the sacrum. This is what's called the auricular surface for the articulation with the wings of the sacrum. Let's go to this area again. So the ilium has two very big, in the ox has also two very big developed projections here called the Coxal Tuberosity and the Sacral Tuberosity. Here, if we want to compare this border here, which named the crest, the iliac crest, is more straight here in the ox comparing to the concave one of the horse, for example. Okay, so here let's go to this view here again. As we described in the horse, the same way here, the spine, the sciatic spine is not that developed here or clear like that one of the horse. So here we have the sciatic spine in front of it. Here we have the sciatic notch. We have two notches. So this is the minor or the lesser sciatic notch, and this is the greater sciatic notch. The greater sciatic notch in the this one here, the greater sciatic notch in the horse was actually a little bit more convex. So again, so this is the spine and this is the two sciatic notches. The greater one is in the front of the spine, the lesser one is behind the spine. As we are in this view, let's move and look at the acetabulum. The acetabulum here is very specific. As you can see, the facies lunata or the lunate surface is divided in the ox into two parts, the greater part and lesser part. So this is the case just in the ox. So that happens actually because there is actually one more notch here called the cranio-ventral notch, divided this surface here into two parts. This is the case just in the ox. So that means in the ox we have two notches. So the normal one, which we learned in other animals, called the acetabular notch, and here we have one extra called the cranio-ventral notch. The cranio-ventral notch. If we stay in this view here, we have again, like the horse, the pubis. The pubis with two branches, so the symphysial and the acetabular branch. Here, this border called the pecten ossus pubis, like that one of the horse. Of course, here we don't have the groove which we saw in the horse because there is no accessory ligament of the head of the femur in the ox. So as we are in this view, we can see here how the ventral border of the symphysis pelvis is very developed and has like big projections, so which we didn't find in the horse. But at the same time, of course, between the two hip bones in the ox, we have also the symphysis pelvis, which could be divided into two parts, the pubic part and the ischial part. Here, of course, the same way in all animals, we have the two very big obturator foramina. Let's go to this view one more time here. In this view again, we can see the ischium with the body. This is the body of the ischium. This is the medial branch, and this is the caudal blade. The ischium here in the ox has a very big ischial tuberosity. I would like to show you the ischial tuberosity of the ox here. Look exactly, you will find how the ischial tuberosity of the ox here is divided into three parts. This is also the same just in the ox. So compared to that one of the horse, if you see something like this here, three parts, like triangular, three parts, that means you have the pelvis of the ox, and here caudal border of the ischium, or both ischium. Here we have the ischial arch, the ischial arch. Okay, so I think this is everything we can see here in the ox, and let's move and look at that one of the camel. So here we have the pelvis of the camel. Of course, good news for all of us that we have the same structures. That means two hip bones, and each hip bone is formed by three bones: the ilium, the pubis, and the ischium. But if you remember, look at the ischium, for example. Here the ischium here has, you know, a very small like caudal blade comparing to the ox and the horse. So in general, the main difference between the camel and the other animals is the shape of the pelvis. Let's start with the ilium. In this case, look at this one here. We can see the wing of the ilium. So for me, the gluteal line is not that, you know, clear comparing to the ox and the horse. We have the sacral tuberosity and the coxal tuberosity. The coxal tuberosity, comparing to, you know, to the horse or cow, is not that developed. Of course, we have very big, you know, coxal tuberosity, but if we want to compare this one to the ox or horse, it's not that, you know, clear. I mean, developed here. Another difference is here the border extends between the sacral tuberosity and the coxal tuberosity. Here it's more concave, you know, more convex, you know, while it was like straight in the ox and concave in the horse. Here it's convex. As you can see, there are a lot of muscular lines here for muscle attachment. So the spine here in the lateral view, yes, we can see here the sciatic spine, but it's not that big. And if you remember, here in front of the spine, we say that we have the greater sciatic notch. It's more flat here comparing to that one of the ox and the horse. They were in the ox and horse, you know, more concave. Here the lesser sciatic notch is very small. It's deep but small comparing to the other animals. Okay, so if you look at the of the acetabulum, yes, so this is another things we have to think about, you know. If you look exactly at this acetabulum, for me it's the facies lunata is not completely divided. There's a small connection here, so but in general this rough surface between the two parts of the facies lunata could divide this facies lunata into two parts. But, you know, from outside there is no extra notch like that one of the ox, for example. So we have just one notch. So that means here we have the facies lunata, we have the acetabular fossa and deeper there, and we have the acetabular notch here. Of course, if we look at the pubic bone or pubis, it's also L-shaped with two branches, acetabular and symphysial. It contributes to the formation of the obturator foramen. Of course, here we have the pecten osseous pubis. No extra groove here for the for extra like accessory ligament, because there is no accessory ligament of the head of the femur bone here. We have a big projection from the symphysis pelvis, which could be divided also into pubic and ischial parts. Here caudally we have the ischial arch, and the ischial tuberosity. It's something similar to that one of the horse, so but it's not divided into three parts like that one of the ox. Okay, this was the pelvis of the camel. Okay, and now let's talk about the pelvis of the sheep. As you can see here in the same way, so we have three bones to form the hip bone. We have the ilium, we have the pubis, and the ischium. The ilium has also like a wing. It's not that wide like that one of the horse or the camel or the ox, for example, with two projections, the coxal tuberosity and the sacral tuberosity. The gluteal line is not that clear, of course, but we have a gluteal line here. Here in the lateral view, we can see the sciatic spine in the middle. Here in front of it, we have the greater sciatic notch, the lesser sciatic notch. It's more flat here comparing to other animals. The acetabulum, for example, in the sheep is not divided, so we have the fascias lunata here, we have the fossa in the middle here, and very narrow acetabulum notch comparing to other animals. So there is no extra notch here like that one of the ox. If we go to the ventral view here, yes, on the medial surface of the wing, we can see here left and right the auricular surface for the articulation with the wings of the sacrum. Here we have the body of the ilium, the area between the body of the ilium and the pubis. We have these two projections. They are very developed here in the sheep. So this is the iliopubic eminence, the iliopubic eminence. We have the pecten ossus pubis here, the symphysis pelvis. So this is adult sheep. That's why the two hip bones are completely fused together. So the symphysis pelvis or symphysis pelvis is also divided into two parts, the pubic part and the ischial part. So if we go and look at the ischium has a body, the medial branch for the formation of the obturator foramen. We have the caudal plate is also very developed like that one of the ox, for example. If you look at the Ischial tuberosity, yeah, it's very developed. Do you remember that one of the ox? It was like divided into three parts. Here it looks, yeah, okay. So it's also divided. If you want to consider this three parts, it's fine, but it's not like that one of the ox, of course. And the ox was like on the corner here with three, separated parts. So it's not the same like here. Of course, we have the two very big here obturator foramina. What else? So nothing special. For example, here we have the iliac crest is a little bit, concave comparing with that one of the ox. Do you remember the ox? In the ox was more straight, so extends between the coxal tuberosity and the sacral tuberosity. So, and now let's move and talk about the pelvis of the dog. So if we look at the pelvis of the dog, let's move this one to the side. So this is the pelvis of the dog. The pelvis of the dog has its own, specific shape. As you can see, of course, it consists of two hip bones. Each has three bones: the ilium, the pubis ventrally here, and the ischium. They meet also together to form the acetabulum. If you look at the acetabulum, let's go to this acetabulum here. If you look at the acetabulum, the fascias lunata is also not divided. Has very smooth surface for the articulation with the head of the femur bone. In the middle here, we have the acetabular fossa, as we described before, the origin of the ligamentum capitis ossus femoris, or the ligament of the head of the femur bone. Here is also clear that the fascias lunata or the lunate surface is not completely closed. Here we have this window, this small window represents actually the acetabular notch. The acetabular notch is very wide here comparing to that one of the sheep, for example. Look at that one of the sheep is very narrow comparing to that one of the dog. What else? If we look in the lateral view here, we can see the ilium with the ilium wing and ilium body. This is the body of the ilium. Here we have the sacral tuberosity and the coxal tuberosity, and this is the only situation here where we have the iliac crest here, like a convex. Yeah, it's a convex iliac crest extends between the coxal tuberosity and the sacral tuberosity. And the sacral tuberosity here on the medial surface of the wing, of course, left and right. We have the auricular surface for the articulation with the wing of the sacrum. Here the sciatic spine is very flat. It's not clear. So here we have the greater sciatic notch, and lesser is here, but it's also not clear just because the spine itself is not clear there. If we move to the pubis, is also L-shaped, has a body, two branches, each the left and the right pubis meet together to form here the pubic part of the symphysis pelvis, while the two the two ischium bones here, they meet together to form the ischial part of the symphysis pelvis. So as you can see here, the pubis and the medial branch of the ischium, they contribute to the formation of the obturator foramens. Here we have also very good developed ischial tuberosities. This is the ischial tuberosities, not divided like that one of the ox or even of the sheep. Here caudally we have the ischial arch, and ventrally it's also clear here, the symphysis pelvis, with two parts, the pubic and the ischial part. Here this border of the pubis represents the pecten osseous pubis or the pecten of pubis. Here left and right we have these two projections here. They are of course not that clear like that one of the sheep, for example. This is the iliopubic eminence, so it's there in the dog, but it's not that developed like that one of other animals. Of course, in cranial to the acetabulum, in the ventral view here, we can see this rough surface here as the area for the attachment of the tendon of the straight muscle of the thigh or rectus femoris muscle. Okay, that's everything we can see here in the pelvis of the dog. So again, the main structures for the comparative anatomy you have to look at is the acetabulum, if it's divided or not, the ischium and the ischial tuberosity, if it's divided or not, and the shape actually of the wing of the ilium and the iliac crest, as we mentioned before. And of course the direction and orientation of the wings of the sacrum, as you can see here, it's more vertical here in the carnivores comparing to that one of the horse and ox or camel, even camel and sheep, for example. They were more flattened cranio-dorsally, like this one here. Look at this one and this one. So here it's more vertical. Comparing to that one of the ox. This is sheep. And again here, as we have them both in our hands, look at the concave iliac crest here comparing to the convex iliac crest here of the pelvis of the dog. So that's everything for the comparative anatomy of the pelvis, and see you later in the next video. We will move and talk about the next bone of the skeleton of the hind limb, which is the os femoris or the femur bone. See you later.